Welcome friends, welcome to part 2 of fever. Now in part 1 we have discussed normal body temperature level, febrile temperature level, thermoregulation, factors influencing normal body temperature and different sites where we measure body temperature. Now our today's topic of discussion is fever versus hyperpyrexia and hyperthermia and pathogenesis of fever. So what is fever? Fever is elevation of body temperature more than normal variation. This is number one part, more than normal variation. What is normal variation? The normal variation was 36.5 to 37.5, that is 97.7 to 99.5, that was normal variation. So it should be more than normal variation and it is decided by everyone more than 99.9 degree Fahrenheit or 37.7 degree centigrade elevation of temperature is fever. So this is number one part. So elevation of temperature more than normal variation. Number two, in conjunction with high hypothalamic set point. That means thermoregulatory set point in hypothalamus, what we have discussed early, will be set to a higher level. So in conjunction with high set thermoregulatory center in hypothalamus. So two parts. Definition of fever contains two parts, elevation of temperature more than normal variation and number two, hypothalamic set point should be at a higher level, suppose 37 to 39 degrees centigrade. It is just like in your home, in air condition, if you set your thermostat at a higher level, ambient temperature gradually will go up. It is just like that. So fever is high, more than normal variation of the temperature in conjunction with high set hypothalamic thermostat or thermoregulatory set point. What is hyperpyrexia? So fever is pyrexia. Now what is hyperpyrexia? When temperature is very high, that is known as hyperpyrexia. So that is more than 41.5 degree centigrade or more than 106.7 degree Fahrenheit, 106.7 degree Fahrenheit. So temperature is very high, that is known as hyperpyrexia. So fever is pyrexia. Now we are telling hyperpyrexia. Hyperpyrexia means temperature is very high, but parallelly thermoregulatory set point is also set at a very high level. So pyrexia is fever, hyperpyrexia is very high fever, but in both the condition it is under control of hypothalamic set point. Now just one point we must understand, in pre-antibiotic era, due to infection, at that point of time there was no antibiotic discovered. So infection is very deadly. So in that time what happens? Infection, suppose some organism entered in your body, proliferates, kills patient, infection is getting amplified like anything, but temperature usually never crosses 106, usually never crosses 106. Now why? It is found in our thermoregulatory center there is a thermal ceiling. And why there is a thermal ceiling? Because when thermal set point is getting activated, at that point of time few neuropeptides probably secreted, and those neuropeptides are having antipyretic property. So parallel two pathways are getting activated. One pathway setting high and activating the whole thermoregulation process, and neuropeptides, they are acting as an antipyretic. So they are controlling the temperature, that is known as thermal ceiling, probably. Now another interesting term is hyperthermia. Now what is hyperthermia? Hyperthermia, that means very high temperature. Very high temperature more than the loss of the body, that means temperature is so high, loss of temperature cannot control that one. That is known as hyperthermia. But parallelly, thermal set point in hypothalamus at normal level, there is no change in hypothalamic thermal set point. That is the most important and interesting part. Then why it is so important? Reason behind, suppose paracetamol or acetaminophen is a very important antipyretic. If we give in pyrexia or hyperpyrexia, it will reduce temperature. But in hyperthermia, thermal set point is normal, so antipyretic will not work. So that is the most important part, where we have to know whether I am dealing with hyperthermia or hyperpyrexia, because in one part, in hyperthermia, antipyretics will not work. In hyperpyrexia, antipyretics will work. So how can I distinguish between these two, whether I am dealing with hyperthermia or hyperpyrexia? Now first, as in all cases in our clinical medicine, preceding history of the patient is very important. First, history of the patient, whether that patient is working in a very hot environment, suppose one person is working in a very hot environment or doing exercise in a summer very hot environment. So if I get that history, that is very important. So history is very important, whether that patient is taking any drug which is blocking sweating, so that is very important. In that case, that patient will develop hyperthermia, not hyperpyrexia. So history is very important to differentiate between hyperpyrexia and hyperthermia. Now clinical examination, one important clinical finding. In hyperthermia, what we will see? Suppose that patient is taking one drug which blocks sweating, and the patient's temperature suddenly, and parallelly he worked in a hot environment or suppose doing some exercise, and patient's temperature is rising. So in that case, if we touch skin, that skin is very hot, but it will be dry because there is no sweat. In contrary, in hyperpyrexia, what will happen, what may happen, when temperature will start rising, peripheral vasoconstriction will occur, and all peripheral blood will go to the central part, and peripheral temperature may be cold. So even the patient is showing hyperpyrexia, that patient's skin may be cold. So on clinical examination, we can differentiate. Number 3, if I give antipyretic like acetaminophen or aspirin as there is no change of thermal set point in hypothalamus in hyperthermia, so there will be no change of temperature. But in hyperpyrexia, it will help, it will reduce temperature. So, response to antipyretics are very important differential finding in this case. So, physical examination, history, response to the antipyretics, these three are very important and crucial differentiating point between hyperthermia and hyperpyrexia. We must mention another term, that is hypothalamic fever. Now, what is hypothalamic fever? Hypothalamus is controlling the whole thermoregulation process. Now, due to some reason, suppose local trauma, tumor, infection or intrinsic hypothalamic malfunction, all may lead to malfunctioning of thermoregulatory center, which may lead to high or low temperature. That means subnormal or supernormal temperature. So, that in that case, that fever is known as hypothalamic fever. But usually in hypothalamic malfunction, we are getting subnormal temperature. So, we have discussed what is fever or pyrexia, what is hyperpyrexia, what is hyperthermia and what is hypothalamic fever. Now, let us enter into an interesting part, the pathogenesis of the fever. Now, before entering into the pathogenesis of the fever, we have to know one terminology which causes fever, that is pyrogen. Now, what is pyrogen? Pyro came from a Greek word, pyro. Pyro means fire. So, pyrogen is a molecule which causes fever, which causes elevation of the body temperature. Now, there are two types of pyrogen. One is exogenous pyrogen, another is endogenous pyrogen. Now, what is exogenous pyrogen? Exogenous pyrogen can be a microbial product, can be a microbial toxin, or can be microbe itself like virus. Now, one important microbial toxin is lipopolysaccharide, which is endotoxin from gram-negative organism. Parallelly, another important is enterotoxin, which is from gram-positive organism like Staphylococcus aureus and Streptococcus type A and B. So, endotoxin and enterotoxin, they are very important exogenous toxin. It is found if we give injection of these toxins to a normal individual, patient's temperature starts rising. So, exogenous pyrogen is very important to stimulate the process of fever. Now, parallelly, endogenous pyrogen. What are endogenous pyrogen? Pyrogens which are produced in our body. Nowadays, this endogenous pyrogen is replaced with the term pyrogenic cytokines. So, the term slightly changed, pyrogenic cytokines. Now, what are the important pyrogenic cytokines? What are the important cytokines which are produced in our body which causes fever? These are interleukin 1, interleukin 6, tumor necrosis factor and ciliary neurotropic factor. These are the 4 important cytokines produced in our body in response to some pyrogenic molecule, exogenous pyrogenic molecule in the form of toxin, byproduct or microbes itself. So, these 4 cytokines are very important to elevate our normal body temperature. Now, what happens? When these cytokines are usually produced from myeloid cells and endothelial cells. Now, these cytokines are produced. Now, when these cytokines are produced, they increase prostaglandin E level in the brain as well as in the periphery. Now, prostaglandin E is produced, or prostaglandin E production is stimulated by these cytokines. Now, what happens? Peripheral prostaglandin, peripheral PGE2 is usually destructed by the lung, but the concentration is high. Due to high PGE2 level, we have myalgia, body ache, arthralgia. So, when a patient is suffering from fever, very often they are telling, I am having body aches, arthralgia, etc., symptomatic features. So, these are due to high peripheral PGE2. Some PGE2 escapes destruction of the lung and enters into the brain. Parallelly, in brain, from endothelial cells, PGE2 is getting produced. Now, the high PGE2 concentration around thermoregulatory center of hypothalamus is detected. Now, where? It is in the circumventricular vascular organ. What is that? It is a capillary network around hypothalamus where thermoregulatory center is situated. In those capillary, PGE2 level is very high. Now, what happens? PGE2 is having 4 receptors: EP1, EP2, EP3, EP4. When PGE2 attaches with these receptors, we are getting 4 different type of functions. Out of that, when PGE2 attaches with EP3 receptor, body temperature started rising. Now, what happens? PGE2 attaches with EP3 receptor. These EP3 receptor usually situated in the glial cells. Now, when EP3 receptor is getting stimulated, production of cyclic AMP is getting high. Now, when production of cyclic AMP is getting high, it is acting as a neurotransmitter, as well as it produces different neurotransmitters. So, those neurotransmitters with cyclic AMP starts stimulating neuronal ends in anterior and posterior hypothalamic thermoregulatory center, and immediately peripheral vasoconstriction starts because thermal set point is getting set in a higher level. So, basic pathogenesis is pyrogenic molecule, infections, everyone stimulates myeloid series and endothelial cells, producing interleukin 1, interleukin 6, tumor necrosis factor and ciliary neutropenic factor. These cytokines, these pyrogenic cytokines in turn produces more PGE, prostaglandin E, and these prostaglandin E getting attached with EP3 receptor, stimulating more production of the cyclic AMP and other neuropeptides, which neurotransmitters, which in turn setting thermal point in a higher set point and immediately started the whole thermoregulatory process like vasoconstriction and so and so. Now, I am showing you the schematic representation what I have explained right at this moment. Infection, this is infection, microbial toxin, mediators, etc. Exogenous pyrogenic molecule stimulating monocytes, macrophage, myeloid series and endothelial cell, producing pyrogenic cytokines, interleukin 1, 6, tumor necrosis factor, that is stimulating hypothalamic endothelium. From hypothalamic endothelium, more PG prostaglandin E is getting synthesized, and that in turn by attaching with EP3 receptor produces more cyclic AMP, and that elevates set point of hypothalamus and started the whole thermoregulation process, heat conservation and heat production leading to fever. So, my dear friends, this is basic pathogenesis of fever. Thank you very much. Today we have discussed fever, hyperpyrexia, hyperthermia as well as pathogenesis of fever. Next day we will discuss on approach to the patient of fever, laboratory investigation, diagnosis and treatment and different treatment regimens of the fever. Thank you very much and we will meet very soon.